started off with Mr. Claude Switzer. He had a farm, he sold it, and he decided to put that money in towards building a rest home for the elderly people.
It was established in 1954, so we've been around for just 51 years actually. I think it was 15 beds initially. Bit by bit by bit, it's built up. We now have 72 beds overall. Over a 5-year period, our back injuries were 270 days off work.
Yeah, I hurt my lower back and started to get a pain down my leg. Far worse than having children. It was so painful. And got really depressed, as you do when you're ill for quite a period of time.
You've got to stop that. Regardless of how much it costs, really, you've got to try and find a way to get the money to stop that. We've tried to make sure that the staff have the tools with which to work. So we've done a lot of applications for grant applications, and we've got a lot of funding for hoists, particularly ceiling hoists and special chairs and special beds. The Trust has spent $100,000 on somebody to, we had a project manager who worked with me, who is a registered nurse and works here now as our patient handling advisor.
16 kg limit was introduced so that staff wouldn't get back injuries, because I believe there was over $30 million, I think it was, paid out through ACC for back injuries in the profession.
So we paid for her salary, and we give her 0.5 of time to be that patient handling advisor for the training, so it's ongoing.
And we've got a little orientation booklet which we give them when they start on how to look after their backs, you know, with the things that they need to look for if they get a sore back, and exercises to help strengthen their back, and it's their responsibility to do that.
And because a lot of us never did exercises and that, you know, you get up out of bed, I'm late, take off to work. I've actually hurt myself doing that.
So it took about a year to get it all implemented by the time we went through the training process and setting all the policies in place, all the guidelines that we needed to do to let the residents' families know what we were doing so that they were okay for their families to be lifted and moved in the safest way possible, so that it was safe for them and for the staff.
That's had a dual effect of reducing our back injuries down to 0 over the last 3 years.
We don't have the work injuries like we used to have, and they're responsible for their own health as well, and the Switzer's responsibility is to ensure that we have the equipment for them to move and handle residents safely.
Well, it took us quite a while to actually get used to the no lifting policy. We were just so all gung-ho at the time, you know, just straight in there and do it. We actually had to teach ourselves to stop.
I think it helps us to retain our staff because they're not pushed as hard as they were. So that's been a great initiative.
Best thing that's happened since sliced bread is this no lifting policy. It's great.
Yeah, sweet dreams. Thank you.